The Centers for Disease Control and Prevention is reversing itself again. Earlier this week, that agency quietly issued a new guideline to restrict COVID testing to people showing symptoms only. But that didn't last long. Our 13 Investigates reporter Sandra Chapman now has the backlash from the experts that forced a flip-flop.
If we're going to get a handle on it, we need to know who's positive and we need to take appropriate action.
The fallout over a new CDC policy to limit testing to only those showing symptoms of COVID-19 was widespread and swift. The agency's director came out with a controversial guidance with the support of the nation's coronavirus task force. But after just 3 days of backlash, the CDC is reportedly walking back its stance.
This recommendation from CDC just didn't make a whole lot of sense to me. So I was very happy to see that today they reversed course.
Paul Halverson is a former CDC manager. He's also the founding dean and professor at the IU Fairbanks School of Public Health. That program conducted the first comprehensive COVID-19 prevalence study in the nation. It showed 1 out of every 11 COVID infections came from symptomatic or high-risk people. 45% of those who tested positive for active viral infection were asymptomatic. They had no symptoms. And individuals were 12 times more likely to test positive if living with someone who had already tested positive.
Over 40% of the people that have positive results are asymptomatic. Of course, that means that people could have the disease, it could be spreading COVID and not necessarily know that. So that's why testing is so darn important.
The Indiana State Department of Health hasn't wavered and recommends anyone who lives or works in Indiana can be tested at an Optum site, but should consider getting tested, particularly if you are at high risk. That includes those over age 65 with underlying health conditions, or if you are a member of a minority population that's at greater risk, even if you don't have symptoms. This also includes close contacts of confirmed COVID-19 positive patients. As for the CDC's decision to relax the 14-day self-quarantine for international travelers or those making domestic trips to states with high infection rates, the CDC is holding steady on that. Halverson says he understands in part because some countries actually have lower COVID-19 rates, but he says if it has to be all or none, he would uphold the 14-day quarantine.
I think it's only prudent that you self-isolate and just make sure that you're not part of the problem.
All of those experts agree on those recommendations to stop the spread. They include things that we've been talking about so many times: wearing a face mask, washing your hands frequently, and social distancing when it's possible. Well, the FDA came out with a new warning about hand sanitizers. Watch out for sanitizer packaged in containers that make them look like things like food or drinks. That agency received reports of containers resembling everything from beer cans to water bottles, juice bottles, even children's food pouches. Some of these hand sanitizers have flavors like raspberry or chocolate. If you buy one of those, don't leave them out where your kids could get them and accidentally eat or drink it. That, of course, could hurt them.
Well, many businesses right now are struggling during the pandemic, but what about those particular businesses that perhaps are female or minority owned and were facing challenges even before COVID and before COVID concerns? Well, Nell Merlino founded the Take Your Daughter to Work Day program. That was 30 years ago. Now she's heading up the Count Me In revival. It's making sure that these groups have access to a list of organizations that are organized to provide free grants. In the first round of grants back in July, they helped hand out $250,000 to these minority and female-owned businesses.
So if women who own businesses are in need of funds, particularly to pivot their business during the pandemic, where they've seen an opportunity or see a different way to do their business that will be better for their employees, their customers, we want to encourage them to do that. Because when we did this the first time, we got over 2,000 requests for applications. Over 400 women filled them out, and there are great businesses out there. So I want to encourage anyone who is thinking they might be there doing it all by themselves, that there's a community of women out there that's a national community that welcomes you and wants to help you.
You know, there are a lot of organizations that are coming together and jumping in to help. So Count Me In Revival has organized them, done all the research, and posted a list for you conveniently in one place. They also put there together some information on how to fill out all of the required paperwork to get the money. We have this all posted for you on our website at WTHR.com. Just make sure you look for this story.